I am excited to present today on the new 6th edition of Staying Healthy. Okay, so what's changed since the 5th edition of Staying Healthy? There are a few things that have changed, but a lot of the content is the same. The changes in the 6th edition are based on feedback that we've received from the sector and some of the more common inquiries that we receive from services. So today I'll just focus on the elements of staying healthy that are more or the most relevant to the national quality standards. So in particular, I'll look at quality area 2, which is children's health and safety, and quality area 3, which is physical environment. Okay, so let's delve deeper into what's changed and what's new. So I think a really good way of looking at these changes are this is some improvements in the content and they're not really major changes. Something that our expert committee really wanted to do was streamline the processes and the procedures in staying healthy. And again, this was based on a lot of feedback from the sector. So some of the changes are definitely based on improved evidence and an improved understanding of infection control practices. And this is particularly since a lot of evidence was published during the pandemic and post the COVID-19 pandemic. This is obviously supported by just a general improved understanding in the public and in services of how infections occur and are transmitted. So with all of that in mind, we still wanted to make sure that we were supporting educators and other staff to create the most healthy environment possible in services. So something that is new in the 6th edition of Staying Healthy are these 5 key overarching statements. So I'll just go through those 5. So we talk about hand hygiene, nappy changing, environmental cleaning, cleaning up of spills, and the exclusion procedure. So I guess these aren't really new concepts in Staying Healthy, but this was just a way that the expert committee really wanted to highlight these 5 practices as best ways to prevent infection in services. Okay, so these are just a few focus topics that I wanted to cover today. So again, the 6th edition focused on the safety of children and educators while generally encouraging infection prevention skills in that service setting. Teaching infection prevention skills to children is obviously something that's incredibly important from the younger age groups up to the more school-based age groups. And we wanted to ensure that the content just generally encourages infection prevention in daily activities throughout the service. So this is where I just want to highlight quality area 2, which talks about modelling practices. And that is one way that services can teach children about hygiene practices. So an example of this would be modelling hand hygiene, and this is something that can happen before and after meals. So that would look like an educator going over to a basin to wash their hands and dry their hands so the children can see what a hand hygiene procedure looks like. Okay, so this is something that is new for the 6th edition. Fact sheets on symptoms is something that we received a lot of feedback from the services, and this is something that we thought was a bit of a gap and is now included in the 6th edition. So we've got this collection of 5 symptom-based fact sheets. And that is something that's been added to the suite of fact sheets to support educators to identify and manage sickness in services. So diarrhea and vomiting is obviously something that's quite common, and we felt that the advice here is quite practical. So a lot of our clinical advisors gave us the advice that obviously a lot of children won't get a diagnosis of what the pathogen that might be causing diarrhea or vomiting is. So with that in mind, it's quite practical general advice with a 24-hour exclusion period meaning that the child or the adult or educator would be excluded for 24 hours with no symptoms, and then they can return to the service after that. Fever is something that we felt was quite similar. So that 24-hour exclusion period is also for fever. This is something that we've received a lot of feedback on post-publication of the 6th edition as well. So we have since published an update on fever just to ensure that the content is clear for educators, for parents and carers, and that is that children should stay home if they have a temperature above 38 for at least 24 hours. Okay, so exclusion based on symptoms is something that is an important addition in the 6th edition. We got a lot of feedback. Well, we've got a lot of feedback over the years on all the editions, but particularly since the 5th edition, about ways to manage symptoms, particularly respiratory symptoms over the sort of cold and flu season. This is something that was quite hard for the committee to agree on and land on clear advice. And that was despite the fact that there's quite a lot of evidence post-COVID-19 pandemic. But the issue is that there's a bit of a gap. There's not a lot of evidence for the younger age groups, and particularly for those younger age groups in this specific service setting. So with that in mind, the committee landed on this sort of 4-question structure to support educators. First question is there a non-infectious cause, like something like asthma? If it is, yes, let's treat the asthma. If no, let's move to the next question. Is it a new symptom? So is this something that's been going for a long time? We know that we often see like a post-viral cough, particularly in that winter period. That may not be infectious, so we need to consider how long that symptom's been present for. The third question is, are there multiple symptoms or just one? So it's important to consider all of the symptoms as a bit of a package. And then if there are concerning or serious symptoms, there's additional advice for services on what to do and when to act, when to call 000 if it's looking quite serious. I guess overall, that 4th point is probably the most important. So looking at the child as a whole or the educator as a whole, and assessing based on that collection of symptoms, that's something that's really important. And I just wanted to highlight a quote from Chris Blythe, our chair. He mentioned this at the launch, and I thought this was quite a good takeaway quote. So Chris said, "Exclusion is about knowing when to keep kids home and when it's okay to send them." Thought that was a great summary of what we're trying to achieve with this advice. We've also included some new disease fact sheets. So again, based on feedback from the sector, this has been added to the suite of fact sheets that's already quite significant. Asthma was a bit of an interesting one. So obviously asthma is not infectious, but services really asking for that advice to be included in staying healthy. So that's been popped back in as part of the 6th edition. And again, some of those diseases stated on the slide, they're quite rare, but we wanted to respond to the feedback that we were getting on the 5th edition. So a lot of those have been added back in. I'll just touch on ventilation quickly. I think ventilation is something that was part of a broader discussion during the pandemic. And a lot of services were emailing in very concerned about ventilation options and do we need to buy HEPA filters to, ensure that the environment is safe for the staff, educators and the children. So this is sort of just some quick advice that was put together with one of our environmental health experts to give some options to services in terms of ventilation. So we've got 3 different options: natural, mechanical and augmented. Again, unfortunately, the evidence in this space is quite limited in terms of younger children in an early education setting. But our expert committee felt that these 3 options any of these three options would be suitable in a service. So again, this is general advice, and services are able to decide which option suits their setting and their budget at the time and provide a safe physical environment for their children. Again, that relates to quality area 3, which is physical environment. I just wanted to touch on this one as well, because nappy changing is something that happens hundreds of times in services everywhere, every day. So this is just a bit of a comparison between the 5th edition on the left-hand side and the 6th edition on the right-hand side. The committee spent a lot of time revising this process and wanted to make some considerations for how often hand hygiene is performed to make sure it is an appropriate method for preventing infection, and then also provide some options to services in terms of reducing waste, because we did receive a lot of feedback on the waste production from the 5th edition nappy changing procedure. So you'll note the hand hygiene steps in the 6th edition are slightly different. And then we've also included the option for utility gloves to be used rather than single-use disposable gloves. So again, that's a discussion that can be had at the service level on what is most suitable in terms of using utility or single use. It is up to services to decide what's best fit for them. Interestingly, we have had some feedback since the 6th edition was published on the cost about implementing utility gloves for this part of the service. So that's why we've left it open. Services can still use disposable gloves if that is a financial decision for them, rather than implementing the utility glove option. So that is everything. Thank you so much for having me. Please use our icg@nhmrc email if you have any questions. We have a lot of people covering that inbox, so we're pretty responsive. If services have any concerns, we'll get back to you. Thank you.